How's it? This is Zion, and you are watching Joburg Today.
Universal healthcare is a social mandate that requires governments to acknowledge that healthcare is a basic human right. They also need to implement financial and delivery mechanisms that will help to achieve access to needed services in a progressive and sustainable way. So what is South Africa's current position on this, and why is the National Health Insurance Bill still being debated? This was one of the big issues addressed at Africa's largest healthcare exhibition, recently held in Midrand, Johannesburg. Africa's largest health exhibition was first launched in 2011 to bring together the local healthcare sector to look at innovative solutions to healthcare challenges.
We are a UK headquartered company, but I'm based out of our Middle East office, where our flagship event within the healthcare sector, Arab Health, was launched over 40 years ago, which is now one of the big largest exhibitions on the planet. So we have a huge number of healthcare companies from all around the world, and we have to listen to the feedback of what's important to them, where they want to go, what they want to see. And back in 2010, I believe there was a lot of focus towards the African continent and the fact that it was underserviced in terms of a platform putting together the African healthcare sector and international equipment and so on. So in 2011 we launched the exhibition here in Johannesburg. This is the 7th edition now. The show has progressed huge amounts. We have over 600 exhibitors here today from all over the world. We have 17 different government supporting country pavilions. And we have, I don't know exact numbers, but we're talking tens of thousands of attendees from the healthcare sector here, both looking from the commercial element to, either promote their products produced here in Africa or looking at importing from other parts of the world. But possibly more importantly, what we tend to do, as well as the commercial element to our shows, is underpin them with an educational platform. And here in Africa, what we believe is very important is providing accessible education in the healthcare sector. So we're running a number of conferences here, providing CPD points to help train the doctors at very low rates. All of the proceeds of that are donated to local children's charities because, as I said before, we're a UK headquartered company. So to come and work here, we feel like we need to leave some legacy and do something back to the community. So the training and the charity work that we do, I think, ticks them boxes for us.
There were a number of conferences held at the exhibition where topical issues facing the sector were debated. We decided to look into the current state of South Africa's public health service by engaging with healthcare leaders.
Remember, South Africa has got a very painful past, and this past has led to two health systems, private and public. And the public sector servicing the private sector servicing 16% of the population, and the public sector servicing 84% of the population. But when you look at the South African GDP, in terms of the healthcare expenditure, it's 8.5%, 4.4 from the private sector and 4.1 from the public sector. Clearly you can see the inequalities. So we really need to see in terms of how to make sure that everybody benefits equally from the health expenditure point of view.
The need for universal health coverage came up in discussion, as this is regarded as key to ensure that the poor and vulnerable are given access to health care. In South Africa, the National Health Insurance Bill is still being debated.
I think we're at a stage where we cannot afford the current situation. The current situation is unaffordable. 8.5 with poor health outcomes. We need to change. Even anything that you throw, we really need to change. So we need to move from that premise to say point A is not servicing us any better. We need to have equitable access in terms of that. We need to have universal coverage within the South African context. So the topic is not new. When we think about it, even the World Health Organization is talking of universal health coverage. And then it's also taking in terms of accessing health. It's also talking about accessing health at the point of care. And NHI is really trying to make sure that at least we are able to service the whole population equally in terms of that. So definitely I support it. It could be the how part that then we can debate, but not whether we need it or not.
One of the biggest stumbling blocks is vested interest. And that's across the entire continent. It's not only South Africa that's discussing NHI. There are at least 12 other countries that have the bills of NHI in Parliament. And there are some countries that have already implemented a quasi-NHI, such as Ghana, Rwanda, are two countries that stand out as clear examples. We've seen common issues across Africa when NHI is being discussed. And the issue is around the source of funding. If you've seen the continent, we have a very small proportion of formally employed persons. So we have a very small group of formally employed that's paying tax and looking after a large population. And in South Africa, the tax rates are already hovering around 45%. If you're going to increase more tax, either through payroll, whether it's the employer or employee, is that sustainable? And that's where the debate starts becoming a little bit tricky. And you have opposing sides. The private sector favors alternative sources of funding, where you look at resources coming from other industries and other methods, perhaps loading up a health levy, looking at sin tax. And the government tends to fall towards increasing employee tax and employer tax to collect a larger revenue. And so the resistance comes from there. The second issue of great debate is the space of an open market. If by law you're supposed to belong to one single plan that's run by the government, the faith and the trust in that plan is usually very low. The private sector tends to support the view that you should belong to a health plan, but you can choose a health plan of your choice. You could choose an economy plan, you could choose a premium economic plan, or you could choose a club class plan. So I think the private sector believes in choice and competition, with the provisor that the government should look after the vulnerable population and the poor in an effective manner first.
Providing affordable and accessible healthcare remains a priority in Africa. In October 2016, the Africa Healthcare Federation was formed, and 45 countries have come together to progress in this respect.
I think we're winning as far as the direction is concerned, and the focus is concerned, and the togetherness. What we're not doing too well is the pace of progressing towards implementing projects. So there is an incredible desire, both from public and private, to work together. In fact, 10 years ago, one would never think of a public-private partnership unit in the Ministry of Health. Now 17 countries have it well established.
Nashina Mohammed for Joburg Today.